Hey guys, sorry to be a few minutes late. We just had an unexpected fire alarm in our building, so we had to evacuate, and now we're back. And it's kind of an interesting thought of, I wonder if your brain ever feels like it's on fire. So in just a minute, I'm going to bring on board Tom Brady, our wonderful functional nurse practitioner, and also our neurotherapy provider. And he's going to take us through the wonderful world of how our brain looks in its electrical activity. So let's welcome Tom. Hey, Tom.
Hey, Dr. Bettinghouse.
Okay, well, was an exciting time.
Oh, yeah, well, we're out of the sun now. It was hot outside, and we had to stand outside for this fire alarm.
I know. Okay, well, it's a fitting subject to talk about fire in the belly, fire in the brain.
Absolutely, absolutely.
Okay, now, Tom, we know that you're not the famous football player, but why don't you tell us a little bit about how you got involved with Healing Unleashed and a little bit about your involvement with our neurotherapy program.
Absolutely. Well, yeah, I'm not that Tom Brady, but I'm the better one, so we could always argue that. So I started with Healing Unleashed back in 2012. Prior to that, I was a paramedic. I also used to work at St. Anthony Hospital, and I was looking for a change of pace. Actually, my wife found an ad for a job with you guys and ended up interviewing and getting the position, even though I didn't think I had it. It's a different story. But anyways, fast forward a couple years, and now I've been here going on 10 years now, working with, Dr. Bettinghouse, Dr. Joan, seeing all the wonderful therapies that was offered that I never knew before, working in the allopathic side of medicine. So it's just been really nice to see the transitions of patients actually getting better when they follow the protocol and do, what's needed, and not just masking their symptoms, but, actually changing their health.
Yeah. And so, we started doing neurotherapy about almost 10 years ago. We started out with Dr. Penny Montgomery and her particular program, and then we kind of evolved from there. And Tom, you've gone through all the different programs that we've actually used. Is that correct?
That's correct, yeah. When I started working out, Dr. Penny Montgomery, who you interviewed a few weeks ago, used to work in the office with us, and she was the neurotherapy provider back then. And again, I never heard of neurotherapy. I didn't know what it was. I just knew if you had a concussion, you just had to kind of wait it out, wait out the symptoms and live with the brain fog, live with the constant fatigue and all these other symptoms that are associated with traumatic brain injuries. But even beyond traumatic brain injuries, it helped people with anxiety, depression, insomnia, ADD, ADHD, amongst many more other symptoms. So that really sparked my interest to get involved. And I remember coming to you and asking, can I put the electrodes on somebody? And you said yes. So
yes.
That was the beginning of it. And, it was really wonderful to be able to get involved with that and really pique my interest. And then Dr. Nicholas Dobris, who is the founder of Neurofield Neurotherapy, who we actually utilize their equipment, he came out to our office and one-on-one trained us about all this. So we definitely had some of the top experts in the field here to show us, to guide us hand in hand, how to get all this stuff going.
The first time I ever realized that by putting little electrodes on the scalp that you could actually sort of listen to the brain. I think Dr. Montgomery wrote a book called Whispers from the Brain.
Mm-hmm.
And, what we're doing is looking at the electrical activity in the brain to see if there's any areas where the networks are not firing appropriately. So, Tom, why don't you tell us a little bit more about our program and how we obtain our EEGs and, how we go from there with brain maps, et cetera.
Absolutely. So I think the number one question we get to beginning with all this is, what is an EEG? A lot of people really don't understand that concept. You go and you get a blood test done for a CBC, to see what's going on in your blood, or even an EKG of your heart, to see the heart rhythm. But very similar to an EKG, where it's measuring the electrical activity of the heart, you do EEG, an electroencephalogram of the brain, to get the electrical signals of the brain, and then we use a specialized program to convert them from the squiggly lines, which we'll show later, into what's called a brain map, to make it a little more easier to view and see what's going on with each individual hertz within the brain.
Yeah, that's true. And it's amazing what we find out. So why don't you go ahead and show us what a raw EEG looks like, and then
Absolutely.
we'll go through how we create the brain maps and maybe look at a few, okay?
Absolutely. Okay, so I'm going to bring this one up here.
Yeah, are you ready?
I'm ready.
Okay, let's do this, and let's make it like that, okay?
Absolutely. So this right here is an EEG. Okay, all these little squiggly lines isn't just a pen mark on a piece of paper. Right here, all of these actually mean something. So right here on this side, you see all these different little letters. Those are the different locations of the head. It's known as the International 1020 locations. This is very much what like you would use in a hospital when you're looking at an EEG on a patient. Same software. But what you do is you take a look at all the different areas of the head and you compare to see what's going on based off of the person's symptoms. So when we obtain a raw EEG like this, we actually have to filter out what's called artifact. Now, artifact is anything like an eye blink, muscle tension, movement, and so on that interferes with the natural EEG or tracing signals. So if you look here, you see this little area right here that I highlighted. That's actually an eye blink. Okay, that's what happens with the electrical activity in the brain when you blink your eye. And here, I'm going to highlight this little spot. You see how these really stand out and how they're kind of grouped together. That's actually muscle tension. This person right here was scrunching their forehead. You see how it says FP1, FP2, F3, F4, and then down here it goes to F7, F8, and FZ. So that is actually the front of the person's head and face, okay? And when their muscles activate, it causes these really, really tight lines here. So again, that's called artifact. So we have to filter through all that to find out exactly what's going on within the EEG itself to give us a little insight of what we could do to help correct whatever the symptoms are of the patient. In fact, I do have a couple examples here. The first one I actually want to go through is a child that was diagnosed with ADD, ADHD. Something else I'd really like to point out is with ADD and ADHD, it's a symptomatic diagnosis. Okay, it's a questionnaire, to be honest. We here at this office have seen hundreds of kids and adults that have been diagnosed with ADD, ADHD, and truly on a brain map, we've only seen probably a small handful that actually are true ADD, ADHD. So if you give me a moment here, I'm going to actually—
While you're doing that, let me just say something while you're getting the slides up. There are many causes for people to have poor concentration, easy distractibility, other than the diagnosis of ADHD. So many of the patients that we've seen with that, come in with that diagnosis, we've discovered they've actually had old concussions, even when they were a child, okay? So
absolutely.
Until you help the brain heal, it's not really a scar, but it is a blemish that shows up on their brain EEG and their brain map. And that's the cause of their inability to focus and concentrate. So,
right. Well, if you remember, we even saw that one little girl who was born with a vacuum extraction.
Oh, yeah.
And, she had the ADD, ADHD type symptoms, if you will. But it turns out there was just a lack of energy going into the certain parts of the brain to help her to concentrate. So that was another success case that we had. Okay, so I'm going to bring up these pictures here. Okay, you see these wonderful little colorful pictures here? This is what's known as a brain map. I'm not going to get too technical today, But we'll kind of briefly touch on this so that way we know what we're looking at. So when we do a brain map that converts from the raw EEG to what's called a quantitative EEG or a QEEG, it brings up these brain maps that have the different wavelengths: delta, theta, alpha, beta, and high beta. Now, delta is 1 through 4 hertz or cycles per second. Think of that as almost like when you're in a deep sleep, okay? It's a very slow energy wave. Theta is going to be 5 to 8. That's when you're waking up, a little bit drowsy, kind of getting into it. It's also present in people who have had brain injuries, okay? It's where the brain tries to repair itself. Alpha, I'm not going to get too much into alpha. It plays many, many, many different roles within the brain, but it's used in normal, everyday focus and concentration. It's used in mood regulation. It helps to get you to sleep when you close your eyes. So alpha plays a lot of roles within the brain. Now, beta and high beta are 13 to 30 hertz or cycles per second. And beta and high beta are going to be your executive functioning, your thought processes, and so on. It's the fast wave energy forms. Now, this specific brain map right here that I'm showing you, this was a 9-year-old child that was diagnosed with ADD, ADHD. He was unable to sit still in class, unable to focus and concentrate. He didn't learn. He just wasn't interested, okay? So when we look here, these colors represent a standard deviation. Okay, -3 to +3 with 0 in the middle. So when you see blues and dark blue colors on this page, that means whatever we're looking at is hypo or not enough. And when you see yellows, oranges, and reds, that's hyper or too much of whatever we're looking at. So you can see it really pops out that right here in this beta and high beta, he had so much energy going on. Again, just as the joke we were talking about at the beginning, your brain on fire. Well, his brain was going way too fast and unable to allow him to sit still, focus, and concentrate. And along with that, he didn't have enough alpha and even theta with his eyes open to kind of slow it down. Now, I know earlier we talked about theta and delta being slow wave energies, but just because your eyes are open doesn't mean you don't have slow wave energy. You're supposed to have them all going at all times. It's just how much and where. So after many treatments with this kid right here, we could see that he had fast improvement going on. We could see the high beta really, really calm down, okay? We added some more alpha to him that helped him with that, and even regulated a lot of his delta and theta. And so after this, he was able to participate in class. He did really good in his grades. He stopped being hyperactive after all this time because his brain was no longer just bouncing back and forth. He was able to actually focus and concentrate now.
Yeah.
Now, another commonality that we get with, sorry, I'll put on the screen here, with our brain waves here is a TBI, a traumatic brain injury, and concussions. Okay, so I'm going to bring up another one that we did. This is going to be, it's not up here yet, but it's a soccer player. Okay, so she had a concussion, hitting the ball with her head, and had a lot of trouble with concentration, focus, and not able to really do her schoolwork during the time. So I'm going to bring this over. As you can see, this was when she first started coming in. This was after treatments. So what I'm going to point out again was theta is where the brain is trying to repair itself. Again, it's that slow wave energy form. When someone has a lot of theta going on, it's really like thinking through mud. It's really, really hard to focus and concentrate because it's bogging down your brainwave activity. And so you can see right here in her frontal lobe and all on this side here, she had this huge excess of slow wave activity and not a lot of fast wave activity. So it was really hard for her to focus and concentrate. Again, after many sessions and able to treat her successfully, we could see how dramatically the theta went away. And this deficit of beta in her frontal also improved. So afterwards, she was able to focus and concentrate in school, get better grades, and so on. So this was another success story that we had on that.
Oh, that's very interesting. It's amazing to see the improvement in people, not just in their brain maps, but in their symptoms. They can tell the
Absolutely.
difference.
Absolutely, and they just feel better.
Yeah.
And even this next one I'm going to talk about is anxiety and depression. So a lot of us, unfortunately, in today's society live with anxiety, depression, and just kind of chalk it off to, well, that's just our life, right? And what do? We go to our general practitioner and get prescribed a antidepressant in order just to carry us through the day. And, it's normal life to us. Now, this specific patient right here had both anxiety and depression, okay?
Mhm.
So she was diagnosed with GAD, which is Generalized Anxiety and Depression. So one of the big things that she had was what was called hypercoherence, which are these red lines down here. And what hypercoherence means is every single place that you see a red line was a different neural network trying to communicate. And what happens in hypercoherence is those neural networks, they're really, really trying hard to communicate, but they're stuck. The energy is not going anywhere. I've heard Dr. Bettinghouse describe this before as like you're sitting in traffic with nowhere to go. Your energy is there, everywhere's go, but you're just stuck there in traffic, so you can't really go anywhere. So after treatments with her again, you can see that really, really cleared out. She actually had sleep issues beforehand that were resolved. She no longer felt depressed because her brain was communicating correctly. And her anxiety went away because a lot of times when we're not feeling right or we're not able to think right or perform right, that can make us anxious or depressed. It's just a natural feeling. And we could chalk it off to say, well, I'm just anxious and depressed. But a lot of times your brain is just not working correctly. So when you're able to improve the functionality of the brain, you're able to improve your whole self. And that's the real basis behind what we do here. We are a functional medicine clinic. We look at a person as a whole, right? You're not just a brain. You're not just a thyroid. You're not just your gut. You are a whole individual person. And if you could cure your whole self, you will be 100% you.
Okay, I'm going to take this down for a moment.
Absolutely.
Yeah. So your brain is not isolated from the rest of your body. Okay.
It is not.
Now, there have been a few times, Tom, where we have hurried somebody in. I've seen them done a history of physical, and then we go straight to do an EEG, and we don't take the time to assess their gut health or whether or not they're eating non-inflammatory foods. And every time we stop doing that. Now it's like, hey, we got to address the whole body first,
Absolutely.
Lifestyle, nutrition, do some appropriate functional medicine type tests to see if your body needs something, because when the brain has been injured, it needs fatty acids, omega-3 fatty acids. It needs vitamin D. It needs magnesium. It needs other kind of antioxidants that can turn down any inflammation in the brain. And, we're trying to approach this from a really a larger perspective when we do functional medicine, and then we go to an add-on neurotherapy. So we've had quite a few patients that have done better when we address their diet using an elimination diet or something like that, and then we do the testing, and we can go forward from there. It's like a patient that we're working with now comes in with terrible history of anxiety and depression. And so we're going through a lot of metabolic type tests at the same time while we're assessing her brain function. And I'm feeling very hopeful because, she just hasn't gotten better with a lot of different kind of therapies. So it's very important to have a whole picture rather than just doing your brain.
Yes, absolutely. And we have seen that, unfortunately, where we've learned our lesson. We can't just rush a patient through who wants to come in and say, well, I'm here for neurofeedback or neurotherapy. It's just not a good approach, right? Because, again, what happens throughout your whole body affects your whole body. If your gut is inflamed, your brain's going to be inflamed. You have to be able to support your whole body. You can't just walk down the street limping on one leg and expect to run a whole marathon. You have to be able to support the whole body, make sure it's 100% to go in order to completely heal.
Yeah, and we do know that people that have concussions are going to have GI symptoms because of the brain-gut connection through the enteric nervous system in the gut. And, it's just an amazing if we approach this from that perspective.
Absolutely.
Okay, Tom, can you speak to the importance of having an EEG done as a baseline?
Absolutely. So even if you're not experiencing symptoms, if you will, right, it is good to have a baseline of what your brain activity is doing today. And then say 5, 10 years down the road, you're just not feeling yourself. You're not feeling as sharp, or you had a whiplash incident, or you fell down on the ice and hit your head, something, right? You'll have that then baseline of where you were when you were feeling good, and then where you are now, and what we need to do to get you back to point A.
Yeah, that really, I think, is important. We haven't stressed it enough.
Correct.
But we're trying to stress it now.
Yes.
You have your EKG of your heart rhythm, so let's have more people do an EEG, electroencephalogram, so we can see what's going on in your brain.
Absolutely.
So, as we all get a little bit older in this country, we're seeing an increase in a cognitive impairment. It may not be something as serious as Alzheimer's, but we've got to have a sharp brain, a sharp mind. So, okay, now is anybody on board who has any questions or making any comments? And of course, this is recorded. You can watch it later. I know we went over a lot of material, but if you have any questions, you can always call us or reach out to us, because we want to help as many people as we possibly can.
Absolutely.
Okay, Tom, do you have any final words for our wonderful people?
No, I think, again, just the importance of brain health, right? So whole body health is very, very important. Our society nowadays really stresses, okay, let's eat organic, let's do all these things, which is great, but everyone ignores the brain. And so that has to be part of everything you do. And so, again, as you stated earlier, get a baseline of what your brain is doing today in case you need it down the road.
Yeah, Dr. Montgomery always said that when patients are in the hospital for brain injuries, the one thing that is not monitored is their EEG, which is kind of strange, isn't it?
It really
now, I don't
is.
know. I haven't been into a neuro ICU unit, but maybe they're doing that now. I don't know.
I have. During my clinicals, I was in a neuro ICU unit, and unfortunately, all they're looking for most of the time is a stroke pattern, or sorry, epilepsy pattern.
Seizure, yeah.
Seizure activity. So that's all they're really looking for. They're not looking for anything else but that.
Being able to learn and look at the waveforms to see what kind of waveforms indicate what kind of problem in the brain is a skill, and it takes time to learn that. But what we're discovering is the whole field of the neurosciences is just exploding with new information. So, we want to go through our life with a sharp brain that can take us to peak performances when we need them. So, anyway, thank you so much, Tom, for being with us today.
Yep, absolutely.
We're going to be firefighters too. We're going to help put out the fire in your brain, okay?
That's
and your
right.
body. So thanks, guys, for joining us.
All right, thanks, everybody.